Fayo Williams, your regular safety Amazon. And what are we discussing today? Well, today we are joining the wife of the Lagos State Governor who just spoke right now on radio about the World Tuberculosis Day. So you heard her, and we are going to loud it. You know what we mean by loud it? We're going to emphasize all what she has said, and we're looking at the theme, understanding tuberculosis, causes, symptoms, and prevention. And I will be joined by a guest, I hope. He's on his way. Please, Yankee Bravo, don't stop my guest from arriving here. Don't cause any katakata go slow there, eh? My guest is on his way, and his name is Dr. Abdul Rahim Kamaldeen. He is known as Dr. Kamal, a very experienced public health physician with over 10 years experience. He is a senior registrar in the Department of Community Health and Primary Care at Lagos University Teaching Hospital, the one you know as LASU. Okay? He possesses extensive experience in managing tuberculosis patients and has participated in numerous advocacy programs for the welfare of individuals affected by TB. So we are going to delve into that topic today, and we don't want you to get scared. You know, recently there was some awareness about diphtheria too. You know, these diseases, they are there. It's like they're hanging in the wardrobe, you know, until something brings them out. So we need you to be aware of things like issues like the symptoms, how does it present, where does it affect, so that you can also get help when needed. So while my guest is on the way, I'll just take a little intro by telling you that tuberculosis remains one of the most persistent health challenges. I tell you, it has been a health challenge for quite a number of years, and it affects millions of people. It primarily affects the lungs, but it can spread to other parts of the body. So don't think, say, I no cough, not be tuberculosis. Look, it can affect the spine. It can affect other parts of the body. I tell you, even the brain and the kidneys. So tuberculosis is a big deal. It is a big deal, and you must do all you can to prevent it. It has severe complications if left untreated. And the disease, how does it spread? You know, all this face me, I slap you. All those crowded areas, poorly ventilated spaces, like those markets, when they say a boutte of people, you will know what I'm talking about. Plenty people. So diseases can spread in such areas. Early detection and preventive measures are crucial. You must recognize the early warning signs and seek timely medical care. This would help to reduce the impact and prevent further transmission. You see, this is one disease that can go from you. It's contagious, as they say. It can leave you, go to another person, and before you know it, all the people in that particular place where they do jolly together, then go catch them. So if you suspect one person as having it, it is very essential that person must get treated. So let's start off, even while we await our guests, and ask ourselves, what exactly is tuberculosis and how does it spread? Tuberculosis not be village people, they cause them. In case you don't know, it's not village people. It is caused by Mycobacterium tuberculosis. Now, bacteria, very tiny small thing like this, that enters the body. Mainly it affects the lungs, but as we said, it can spread to other parts of the body. Make una remember, I don't talk and say if it affects brain, if it affects kidney, okay? So it can affect other parts of the body, even your spine. Imagine it affecting your spinal column. That is serious. So it spreads through the air when someone who has tuberculosis sneezes, coughs, or talks. Okay? So the droplets that are released from that person's mouth when speaking, coughing, talking, can actually infect another person. So it's very essential for us to detect those who have tuberculosis and encourage them to go for treatment. So I caught something from what Dr. Mrs. Sonwolu said just now. She said there's a helpline, okay? And the helpline that was announced was 3340. Toll-free helpline. Make a call them again, 3340. And she said there are various treatment units that are called DOTS, okay? DOTS, DOTS. Those are tuberculosis treatment units available across the teaching hospitals, across the health centers, across the LGAs in Lagos State. So you will do well to visit one of these. Now, let's go on to early symptoms of tuberculosis. And again, our madam, our first lady, has helped us again. She said, night sweat. When they wake up, be like say they pour water for your body. Fevers, unexplained weight loss. Just they slim, you they lekpa shandy, all of a sudden. That is one of the signs of tuberculosis. If you tire, fatigue, or you have chest pain, you don't fit breathe well, difficulty in breathing, chest pain, these are all symptoms of tuberculosis. Now, if there's a kind of cough that is lasting more than 3 weeks, hey, ladies and gentlemen, cough is not always on. You don't supposed to be doing self-medication. Oh. If you go to a proper hospital, get treated. If it's still lingering on and on, 1 week pass, 2 weeks pass, 3 weeks pass, there are hospitals that can help you to diagnose what is happening properly. All right? So once again, we are commemorating the World Tuberculosis Day today. The theme is understanding tuberculosis causes, symptoms, and prevention. If you would like to call in, all you need to do is to dial 0809 9120 777. You can send a WhatsApp message to that number. I call the number again, 0809 9120 777. In the alternative, if you want dial another line, make una dial 091 53 87 7127. You can get to speak to me, and I hope my guest will be here very soon. He is Dr. Abdul Rahim Kamaldeen, the one you know as Dr. Kamal, a public health physician with over 10 years experience. I'm sure he's on his way to the studio to tell us more about tuberculosis. But while we are waiting, can we take this traffic update?
All right, just you tuned to Lagos Traffic Radio 96.1 FM. Let's remind you that Ikorodu Road is still looking very, very okay. Coming from the rear, inward Ojota, linking the interchange. From the interchange, you have a bit of build-up there due to the merging around that area. The rest of the journey inward Tipa Garage is a lot better. From Tipa, inward Demory, I can see a slight build-up there also. And that's occasioned by several activities ongoing at Demory. I did say earlier also that Latif Jakonde is looking very, very good. If you're within that area also, just to keep it within the speed limit. All right, let's see what we have from the control room. Okay, from Igondo this evening, Isheri roundabout along Lasu Igondo Iba Road to Power Line Diamond Estate Iduwegba Hotel Lanre. It's all smooth. Slow at Okofilian due to bad portion of the road. General Hospital Alajiede NYC College Igondo Phase 1 and 2 Teweto Malade Olowonla Olonfemi Akeson Afolabi Obadore Yanreba. It's all looking smooth. Likewise, the return journey this afternoon.
Thank you very much for staying tuned on the safety train. You are still on Lagos Traffic Radio 96.1 FM, and we have been discussing World Tuberculosis Day, understanding tuberculosis causes, symptoms, and prevention. My name remains Fayo Williams, and while I await my guest, Dr. Abdul Rahim Kamaldeen, we have been defining what tuberculosis is all about and which organs can it affect. We also looked at the issue of symptoms whereby you can begin to suspect that this person might have tuberculosis and therefore you need to get help. So we mentioned some of the symptoms as persistent cough lasting more than 3 weeks, fever, night sweats, unexplained weight loss, fatigue, chest pain, or difficulty in breathing. These are some of the symptoms we have mentioned. And if you see somebody will get that symptom, not be to say, hey, you see that girl, you see that man, he gets TB or make una fat. No, 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 no. Even the wife of the state governor has said you must not stigmatize somebody who has tuberculosis. That wouldn't be of any help at all to their mental state. And remember, one for all for one, we have to be our brother's keeper. What you need to do is to share the helpline 3340. Make una write them somewhere. If you see person where they cough 3 weeks, make una share helpline, tuberculosis helpline with them. 3340. Or you visit DOTS, DOTS, the treatment centers for tuberculosis, which are all over Lagos State. You can get respite there in case of the infection. So how is tuberculosis diagnosed? Now, I will take you down memory lane, because when I was in school, they used to bring one gun like that. They will put something on our forearm. We used to call it number. Please, if you can relate with me, and you are in that my generation, I will not tell you my age, because we did radio. In case somebody want to give me, you win. So, if you can relate with what I'm saying about that test that we used to receive in order to detect whether there's the tuberculin, bacteria, it's called a skin test. Okay? So it can be diagnosed through the skin tuberculin skin test. TST, a small injection that goes under the skin to check for a reaction. So there will be some kind of swelling, to show that, this person has tuberculosis. You could also have a chest x-ray done to detect lung abnormalities. Okay? And there is the one they call a sputum test. So when you go to hospital and they give you one small container, they say, go and do kalebe. Inside, don't say, they want to use it for ritual. No, 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 no. We are here to dispel all these wrong notions about health tests and getting treatments. Please note that these are researched medical initiatives that would help us to properly diagnose if the person has tuberculosis. So once again, for diagnosis of tuberculosis, you could have the tuberculin skin test, the one they call TST. You could have an x-ray, and not be you they look now doctor go look for deformities in the chest x-ray. There could also be sputum test, in which case they ask you to spit. They want to see the caliber when they come out and then it goes into the lab for further tests before they come up with the results. They analyze the mucus to know whether there are any tuberculosis bacteria in it. You could also have a blood test too, to detect TB infection. So all these are important aspects of testing, of diagnosis, of analysis of the tuberculin bacteria. Is TB curable? Now, big question be that, is it curable? If you ask me, now who I go ask? Okay, let me answer the question. And we need to know what treatments are available. I tell you, TB is curable. Oh, yes. If you have a proper 6-month regimen of antibiotics and the patient is taking it diligently. Not be say you go they do 100. If they give you tuberculosis medicine, make una they take them regular. Because you they do yourself if you not take them regular. So you are supposed to take a correct dose over 6 months. You'll be asked to take plenty of fluid. You'll be asked to do certain things, okay? Combination of drugs will be given to you, but we are not going to call the names of the drug. We don't want you to go to roundabouts and go and be looking for it, okay? Tuberculosis is the kind of infection that requires proper medical attention. If you mishandle it, we have told you some of the consequences. It could go into other parts of the body, and you don't want that to happen, okay? So it is very important to complete the dose. Don't say, motimu, otisu mi jare. You say, I've been drinking the medicine, I don't tire. No. This one is not something you go tire. You go drink am. Correct, 6 months. And then you'll be healthy, you'll be well. It's very, very important. I have seen people who have recovered from tuberculosis. Okay? So once again, if you would like to join this discussion, particularly as the wife of our dear governor, Dr. Mrs. Ibijoke Sanwo-Olu, had dropped the message earlier about World Tuberculosis Day, letting us know the helpline, which is 3340, telling us about DOTS, the treatment centers all around Lagos. If you would like to join the conversation, all you have to do is to dial 0809 9120777 or drop a WhatsApp message on that line. In the alternative, you can dial 091 5387 7127. So those are the numbers you can call in order to get moving and to get more information about treatment. No stigmatization. You are going to drive it in and make people conceal it if you start stigmatizing. We need to help them, and we need to let them know that you can always get to the DOT center or get help. So who is at a high risk of developing TB? People at a higher risk include individuals with weakened immune system. For instance, those who already have an underlying disease like HIV/AIDS, they have a higher risk of developing tuberculosis. People who are malnourished, you know, at times some people will just be taking garri in the morning by in the afternoon. Ladies and gentlemen, not be food be that too. It's food, but it's not food, if I can put it in inverted commas, because there are 5 classes of food. The carbohydrate, the protein, the vitamins and minerals, the oil and fat, everything is mixed up a balanced diet. Not be to say garri in the morning, by in the afternoon, fufu at night. Okay? So in such cases, they are at a higher risk of developing TB. People who are living in crowded conditions. You know, government, they talk and we don't want slums. We don't want all these places that are overcrowded, where you have migrants coming in on a daily basis into Lagos. This is a no-no, because in such an area, tuberculosis could be rife. Healthcare workers are exposed to TB patients. It's part of their care. They do personal protective equipment. They take that on. They wear their face masks. They use their face gloves. Medical workers, at this time, please be reminded to use your PPE. And lastly, smokers and those with chronic lung diseases are also at a higher risk of developing TB. Over to you, Taro.
All right, you've been listening to the voice of Fayo Williams on today's edition of Safety Train. Well, the roads are still looking very free at this time. Should you encounter any form of build-up out there, just be patient and try to please cooperate with the traffic managers wherever you find them. Very, very important. And let's just keep it that way, all right? Keep it within the speed limit. Should you see something, endeavor to say something.
Thank you very much for staying tuned to Safety Train on Lagos Traffic Radio. We are on the home stretch, and we will just take a question related to latent TB, active TB. What is the difference now when you say something is latent, something is active? Okay, latent TB occurs when a person has the tuberculous bacteria in their body, but they don't show symptoms. So, they show for face. You don't go no safe, because this person is not showing symptoms or spreading the disease. But active TB, on the other hand, means that the bacteria are multiplying, they have caused illness, possibly you'll be perceiving some of the symptoms, all that high fever, the night sweat that we spoke about, that our doctor, Mrs., our first lady, who mentioned all the symptoms for us so that we can be aware. She mentioned them, and all these could be active in the person. You could observe it. This would make this particular person infective, highly infective. So if you are close to this person, you are working with this person, you are likely to get the infection. So this person needs to go for treatment. How can we prevent tuberculosis? This is $1 million question. Firstly, let us make sure all the children are vaccinated. There is BCG vaccine, particularly for infants. Mothers, fathers, please do not associate any wrongdoing to vaccine. Oh, if I give the child vaccine, he will not have brother or sister. Please, all those things are what? Foul. Okay? This child will be well protected if you get the BCG vaccine for the child. Secondly, there must be early diagnosis and treatment to reduce transmission. You find somebody coughing within your environment, losing weight, having fever, it is necessary for us to get proper diagnosis. Now, there must be good ventilation in homes and workplaces. Wearing masks and hygiene, particularly for the health workers, is essential. Is there a vaccine for tuberculosis? Yes. That BCG vaccine I told you is called the Bacillus Calmette-Guerin vaccine, BCG, and is available, but is mainly given to infants and children in high-risk areas. It offers partial protection against severe forms of TB. All right, so ladies and gentlemen, we've had a good explanation of understanding tuberculosis, looked at the causes, looked at the symptoms. The symptoms, like I said, weight loss, fever, night sweats. These are things you can watch out for. And then prevention, avoiding crowded places, avoid being in the company of infected individuals, making sure children get their vaccination and that there's good ventilation at home. So it is a wrap on Safety Train this beautiful Tuesday evening. This program was proudly supported by Rely Supply Limited, providers of first aid boxes and training. For brand promotion on radio or access to our services, you can call 081 81 31 3156. I am also available across social media at Fayo Williams is my handle. Till I come your way again next Tuesday, it's via con Dios, which means go with God.
In a city that never sleeps, and traffic that never slumbers. We at Lagos Traffic Radio are always on time with traffic updates as you navigate through the smart city of Lagos. Lagos Traffic Radio, 96.1 FM, moving Lagos forward.
Chai, my head, oh. Oga landlord, why you dey shake like ceiling fan? My village people don't come again, oh. This one with your body hot so. You don't do test? Yes, see result, oh. Oga landlord, no be your village people, oh. Na malaria, you need Luta. Luta na better medicine. We dey knock down malaria. Oya see am, take am. Hey, thank you, Oga Luta. I don't dey can't pay. Luther, brand of Artemeta and Lumefantrine, is another quality product from Hovid, marketed by Pharmatex Nigeria Limited. If symptoms persist after 3 days, see your doctor.
Everybody say thanks, Luther. Malaria's in big trouble.
Are you in the Agro Island food and beverage manufacturing, printing, or packaging industry? Get ready to position your business for success. Meet potential customers and collaborate with global industry leaders at one of Nigeria's biggest international trade shows. Agro Food and Plastprint Pack Nigeria marks 10 years of connecting businesses and driving growth. Join us at the Landmark Event Center, Victoria Island, Lagos, from March 25th to March 27th, 2025, for an anniversary edition packed with opportunities. Meet with exhibitors from Europe, Germany, Italy, the Netherlands, Asia, and Africa to showcase your products, innovations, and machine requirements. You can also sponsor to gain high-level exposure or attend as a visitor to explore new opportunities. Register now at www.agrofood